Okay, so Assalamu alaikum. Welcome everyone on board. Today we will just try to have few words about like how we can get into the training program or get the equivalence pathway. Mainly because we are mainly we will be focusing with reference to anesthesia, but a lot of things will be common, and we will just are joined by Dr. Hina Amir Abbassi, who is our respected colleague, and she is consultant in UK. Over to you, Hina. You can introduce yourself, and then we can proceed.
कहाँ चली गई थी मैडम आप?
हेलो
Yes, Hina.
हेलो जी अस्सलाम वालेकुम जी uh, so मेरा
Hina,
नाम डॉक्टर हिना
Hina, I'm
है
sorry. I'm sorry
uh,
to interrupt you. There are international speakers from all over the world. So, uh, talk in, I think I'll only communicate in English.
all right, okay, I thought that it's from
Apologies,
Pakistan. All
apologies.
right,
Actually,
no, no, no.
even I'm surprised, and Hina is surprised because yesterday Hina was surprised to join, but unfortunately there was some miscommunication and she couldn't join. So today, because it's a Sunday in UK, and so uh, I requested Hina to just have few words about CESR pathway and how to become consultant, how to excel in UK. So there are people, some of the people, pardon if someone from other specialty just raise the hand, we will just try to accommodate you people as well, but mainly focus will be on anesthesia. But there will be some common points, and from there on, you can just make your base, and the rest of the like information, if we are able to get in future, we will be able to get some other specialty doctors on board, so we will continue. So sorry, Hina, just please start.
So all right, so basically my introduction is that I came to brief introduction is that I am working as a consultant anesthetist at University Hospital Leicester, and I came to UK in 2015. I did my fellowship FCPS in Pakistan, and I just worked as 1 year as a consultant there, and then immediately came here. I did my FCI initially Irish exam, and then I did my FRCA. I always intended to do Caesar because this was the way. So basically, in order to work as a consultant, either you enter into training pathway or you do your Caesar paperwork. What does Caesar mean is that you are actually showing General Medical Council or Royal College of Anesthesia that you have got this and this much of evidence from back home, and you are actually topping it up. So I always use the word top up for everyone who are doing Caesar stuff, because your evidence from back is not enough, right? It's not enough because we actually do 4 years of training program, whereas over here in UK it is a 7 years of training program. Another thing is that we have got an exit exam where have their exam like FRCA is not an exit exam. It's just like a exam that you can do after ST5, or some people even do it quite early as well. So it's not an exit exam. Third thing is that in UK, it's not just the completion of modules which we are doing. For example, in Pakistan or in anywhere in the world, what we actually do is that we start our training, okay, and what we do that we are rotated into certain specialty. For example, we are rotated into obstetrics, we are rotated into neuro, we are rotated into peds, and we spend certain amount of time in those theaters, elective day work. Our on calls are different, and in on calls we do either trauma or emergency, whatever emergency comes, but we spend certain amount of time, and then at the end of year or end of 2 years, our supervisor, if they're happy, they sign our logbooks. But over here in UK, whatever we are doing, that is there and then type of thing. For example, there is a educational supervisor, and then there is also a clinical supervisor who look after you, and they actually sign you off for a lot of For example, you come and you start and you do your intubation, they sign you off for that. You have managed a case, they sign you off for that. How was your communication? They sign you for that. So today my talk is basically a brief introduction. Because the time was too short, so I was not able to share my slides and other stuff. But in next one, I will be able to do that. Uh, Whenever you are planning to come to UK, try to apply for a hospital that is a tertiary care or a university hospital. Number one thing. Second thing is that all your evidence you have got from back home, even if it is old one, try to bring it with you. Either it is in your scanned copy or either you can put your logbooks. So these days CPSP is very good that you can have your logbook in computerized or digitalized way. uh, Bring it as well. Whatever you were working for example, if you're working in a department and there were like caseloads of 250 cases a month, or that much bedded hospital, you also have to bring your job plan, your rota, your teaching which you have been doing, like anything that we were doing. We were participating in ALS teaching, BLS teaching, anything back home, nursing teaching. So you have to bring all of this stuff. The reason why I'm saying is this, that nothing goes wasted, right? And try to, like, it's just like a bit and bit pieces type of stuff, that you have to make sure that you are not leaving anything back home. Okay. What I did is that I brought all the stuff. CPSP curriculum is very important. Bring that as well. Whatever your supervisors thought about you, what of your reference letters, everything. And then bring them. Your first year working in UK is always, you just imagine that you are starting a new journey. It's not going to be straightforward. So you will be facing some problems, you will be facing some issues in terms of settling into your department, settling into a new country. So try to always give yourself some time. I have seen people who just immediately come to UK, and within 1 month of time or 2 months of time they start saying, oh, we want to do Caesar, tell us how we can do that. And then when I start asking them, I find out that there isn't any homework done from back home. So homework is very important. First thing is that because your referee and your most important verifier is the person with which you are working at present. Okay. So for example, you started your job in UK, right? No matter how good you are, no matter how competent you are, but if you are not good over there in their eyes, or if you are not competent enough, or you are not able to show your skills properly, so what can happen is that there are very specific questions, because I go through these CESR applications. I've been like referee and verifier as well. And There are very direct questions. Will you be able to hire this person as a consultant in your hospital? Or do you have any concerns regarding their practices? They ask us as a referee, and it's our obligation to tell them truth. Even if I've got slightest concern, for example, if I have got slightest concern, yes, this person can work, but sometimes this person need bit of supervision, or I feel that this person has not done enough pediatric anesthesia. So your referee is the most important person. I have seen people who have done brilliant training program back home in Pakistan, but when it came to their referee, those referee refused to give them good reference. That is very important. And I have seen people whose application got rejected couple of times, just because they had
Give me a
issues
blend.
with
Yes, I
the
already did.
or were not happy to give them
Give
any
me the
reference.
last bit.
So these things are very, very, very important. Another thing is that when I'm saying topping up, so what do you mean by topping up? So for example, you are working in a hospital and your job plan over here, because you start as a registrar, you come here as a registrar over here, but you will be given some theater list, or you will be working in obstetric or maternity, or you will be working in ICU, to try to take advantage. So what I did is that because I always enjoyed working in ICU anyway, so I took advantage of that time. I felt that, so basically, our CESR requirement, it is divided into two things. One is clinical domains and other is non-clinical domains. When I'm saying non-clinical domains is that how is your relationship with your colleagues? How are you as a safe person? How is your behavior? Are you making sure that you are if a person is coming with learning difficulty or safeguarding issues, do you take that into account? Are you taking part in clinical audits or other stuff? So all your clinical non-clinical domains, which is a good chunky part, and they have now separated it in the new CESR thingy. So GMC has recently and Royal College have recently changed their curriculum. Okay, and in this new curriculum they have separated. So they have separated clinical domains. Clinical domain included pediatric, neuro, obstetrics, ICU, and all that general anesthesia, which includes airway and other stuff. Okay, and the other thing is that the non-clinical domain is like your profile. Let me just take it out. Like how are you as a professional person? For example, are you taking care of your professional behaviorism? How is your team working? Stuff like that. And then people are worried that how we are going to show it to them. So basically the way you show it to them is that you do multiple source feedbacks. Immediately when whenever a trainee, whenever a non-trainee, anyone who is joining this a department, we tell them to enter into lifelong learning thing. So Royal College of Anesthesia, first of all you have to get registered to Royal College of Anesthesia. Then they give you access to lifelong learning platform. So lifelong learning platform
I'm
is
sorry,
that
Hina.
you,
Sorry to interrupt you. I was just trying to find. Is it the relevant paper? This is GMC
Royal College.
special.
So, for example, if you just write down Royal College of Anesthesia lifelong learning platform, uh, if you just write it down, so it will you will be able to find out. It is called either LLP, RCOA LLP. So you will be able to find out. So we have to get registered into this, and we have to upload whatever we are doing. So yeah, if you can even find out in YouTube, because they have clearly shown this thing
So we have to
in
register
the
and we have to log in, and then only we can access.
exactly. So they will give you a
Okay.
login account. So if you go on YouTube and if you just type lifelong learning platform Royal College of Anesthesia, so our Royal College of Anesthesia is very good, because I speak to other specialty, other domains people as well, who are from surgery, who are from medicine. Our Royal College is letting non-training grades like specialty doctors, or anyone who is coming from outside or immigrant. They are letting them to get registered into lifelong learning platform. Number one, they are letting them to uh, put all their evidence into this. And then uh, I'm not sure whether how you are able to show this lifelong. What I will do is that in my next meeting, I will take out the pictures, and I will show
I
you.
think this for this need to log in, am I right? What about this
No, no, no.
paper?
If you just go
What
into yeah. So I'll show you how we do it. So what we do, the only thing what I want to tell you is that with Royal College of Anesthesia, with lifelong learning platform, we actually, it is the most important thing, because what we do is that they have got like very they have got certain domains like obstetrics, ICU, or your like non-clinical domain as well, like education training, safeguarding, safety and quality, all these things. And in your clinical domain, they also have got certain things like procedural sedation, pain management, intensive care, special interest, perioperative medicine, all these things. So whatever you are doing, you will be able to put it into lifelong learning platform. And you can also ask one of the consultants with whom you are working, either they are supervising you closely or distant supervision. You can ask them that, can I send you that workplace based assessment, which is called SLE these days, is structured learning thing. And they can sign you off, yes, we are happy this person. So the reason why I'm telling you all this thing is that back home we were not doing all these lifelong learning things, or workplace based assessments, or SLEs. that extensively, but over here it is
Sorry,
very
Hina, what
important.
is SLE?
SLE stands for, so because previously it was called workplace based assessment, like
Okay,
workplace based assessment is just like, if you type workplace based assessment, is just like SLE. SLE is structured learning evidence.
structured learning
Learning evidence.
evidence. Okay,
Yeah.
so
As the name defines, that whatever you are doing, okay, it has to be structured. Like
sorry,
Royal College wants.
one more question. What about this
Yeah.
document? This is with reference to anesthetic,
So
CCST, and
basically, yes,
CESR. Is it the same one?
exactly. This is from journal. Yeah, it's not structured. Sorry, Dr. Zishan, it is supervised learning event. SLE.
Supervise,
SLE.
supervise.
Yes, supervised learning event. Supervised
Assalamualaikum.
learning evidence or event. So yeah, so with GMC, the thing that you have just shown, because
Just a second.
GMC has to oversee all other specialties as well. So this is
Mhm.
a summary that they expect you to do this. And so basically, when you are starting your CESR application, it has to be on GMC platform, right?
Mhm.
And
So
then
is
just
it the
like
document
you are
which
doing.
can help them, like this professional behavior and
Well,
communication management?
yes, yes, it can help them. But as I said, that because it is just telling you that you should be, for example, if I look at it, it says that domain one professional behavior and communication, right? And but the specialty doctor or other doctor will come and ask me that, Hina, how can I show my professional development and communication? Then uh, it is the Royal College lifelong learning platform that will tell you that in order to have your professional development and communication, for example, if you are doing a case, right, it is not only the case. All right, so I always tell my trainees and non-trainees who are working with me is that if you are doing a case, if you are doing a list, if you are working in ICU, if you are working in maternity or obstetric, whatever you're doing, uh, just make sure that at least 3 or 4 of your domains are linked together, and you are able to put into that and send it to a consultant. For example, I am doing a case of emergency tracheostomy. Okay. And then I'm going to send a difficult airway, I'm going to send a patient with ASA3 or perioperative management, or so, the 2 or 3 of my domains, I'm trying to cross link uh, them and attach it when I am filling my lifelong learning. I will also try to fill that how was my communication, so I will put domain one as well. Did I take care of safety and quality? Yes, I do WHO checklist at the start of every list, so that can also be take. Education and training, if there was a junior trainee with me, or if there was a associate physician or any nursing, I just spoke to them or I try to teach them, so you can do that. Or any learning outcome, so these things you can also cross link. So the thing is that it's very hard for me to explain this at this point of time until you are in UK and you have started this lifelong learning platform, because people ask that can we get registered in lifelong learning platform. So at the moment, people who are outside UK, they are not able to register with that lifelong learning platform, but who are in UK, they can do that, at least for what I know currently till
Okay,
this point.
just
They might change.
I will, Hina, I will just rephrase what you are saying, that lifelong, platform, there you can get the evidence from the consultant or from the referee you are working with. Am I right?
No. So this basically, for example, I'm working with a person and I am the one who is doing CESR. Okay. So what
Okay,
I did is that, for example, I did a case. Okay. And I opened my lifelong learning platform.
okay,
What I will do is that I have to first enter that today I did an ENT list or airway list, for example. So that is one thing that is clinical. But now I also have to attach certain things like safeguarding, safety, or perioperative, anything, or team and communication, anything. Then I will attach that thing to a certain case as well, and then I will send it to the person I was working with, who will be my clinical supervisor. So over here, your clinical supervisor can be 10 different persons. So any person you are working with is your clinical supervisor, but there is just one educational supervisor. But when I'm saying one educational supervisor, so every trainee is allocated as an educational supervisor. Similarly, big trusts or university hospitals, whenever a specialty doctor or non-training doctor, they join that hospital, they, for example, I'm educational supervisor of 6 or 7 specialty doctors, and I'm educational supervisor for trainees as well. So they will send that thing to me, and they will have continuously meetings with me. They will tell me, and they will discuss their progress, that how they have been progressing. I will tell them that, look, you are not doing this correct, or look, you need to do this much more. So I'm their educational supervisor. Educational supervisor is just like a parent, right? Who is actually guiding their trainee, or in our hospital, I look after my specialty doctors as well, so I'm their educational supervisor. But I also have to make sure that if they are working with someone in theater, so that person becomes their clinical supervisor, and they send this evidence to that consultant who was watching them, who was supervising them at that point of time. But I as an educational supervisor can also see the progress of my trainee or my specialty doctors. Okay, so I can have access to their lifelong learning platform, what they are doing. For example, if my specialty doctor, if my trainee, of my SD or fellow has got a teaching next week, right? They do a teaching, but I always ask them that, can you please put this teaching in that lifelong learning platform? What was the like feedback? How was other stuff? So I always ask them to put them, and I'm able to see that. So stuff like that.
Okay, so Hina, sorry,
Okay.
I will interrupt you again. Just one more question, that this educational supervisor and clinical supervisor is only designated when you accept someone in a CESR program. Am I right?
No, no, no,
This
no,
is
no. So basically, a lot of people. So basically, now Royal College of Anesthesia, uh, and GMC requires all trust that we have to have a supervisor, educational supervisor. Any person who is coming to UK, they have got their certain needs, right? For example, if you are coming to UK, even if you do not want to do Caesar, but you want to know the system, you want to know that after every 1 year you have to pass a appraisal system, you have to go through appraisal, you have to do stuff like this, that how many CPD points you need per year, what courses you need to attend. So it is the educational supervisor they can talk to. Is educational supervisor is needed for each and every. So
okay.
previously
Just
there was
one
no
more thing.
educational supervisor for students.
I'm sorry, Hina. Sorry to interrupt you again. So there will be the people. I'm just trying to make it even simpler. The Caesar pathway will be one people. CCST people will be the other one. Non-consultant hospital doctors will be one category. And what about the people who are staff level? What is staff level? So
So
they will also.
basically, yeah, basically non-consultant hospital doctor or staff level, basically they are the one, like they are specialty doctors, they are the we call them a specialty doctor over here, but other hospital can call them staff grades, other hospital can call
No,
them
they
middle grade, and they have
all
got
these will
multiple.
have this one educational supervisor and number of clinical supervisor. Am I right?
Well, clinical supervisor is a person
Who is
whom you are working with,
sure?
right, in theater, and you can send your form to. So clinical supervisor can be anyone. Okay.
Okay.
uh, the educational supervisor, good trusts, university hospital trusts, or teaching trust, they make sure that their specialty doctors, they have got an educational supervisor. Okay. And if they do not have education, for example, there are certain specialty doctors who are not like career oriented, they just want to come and do service provision, they have got their certain goals in their life, and they are quite happy about it, that look, we have achieved this much, we wanted to come to UK, we are doing this much amount of work, we are happy, we are earning this much income, we are happy. uh, so they actually do not need educational supervisor, but they have got an appraiser who will look after them after every 1 whole year, that how much they have done, how much CPD program they have collected, what was their problems, what was their behavior. If there is any complaint, they can directly like discuss with their appraiser. So it's like this. So educational supervisor is usually for the person. For example, if you are coming to UK and you want to do CESR, so lifelong learning and Royal College will ask you who is your educational supervisor. So you have to ask your in your department that who is going to be my educational supervisor, and that person will be your educational supervisor. Every trust has got different educational supervisors, and because I look after my CESR doctors or specialty doctors, so I automatically become their educational supervisor. I
Okay.
usually have got a meeting with them every 3 months,
Okay,
right?
Hina, just for some of the people maybe who are not from anesthesia, is it almost like this, similar in every other specialty? Am I right? So they will have some learning
No,
goals?
no,
No,
no. So every specialty is different.
as
Every
different.
specialty would have yes, especially every specialty is different. Every specialty's learning goals and the way they take things, they are very different.
Okay.
The key thing is that once you join your trust, NHS trust, you have to ask your department tell head or your immediate consultant, anyone, that who is going to
Okay.
be our educational supervisor. Educational supervisor, as I say, is someone who look after you, who look after your educational need, who look after your clinical progress, who look after that how much CPD you have earned, or if you want to get rotated to get your, for example, in our trust, if someone wants to get their neuro module signed off, right, and I
Mhm.
have to make sure that it's not happening in my trust, or seats not available for anything. So what I do is that I request other trusts, okay, and I ask them that can I send this specialty doctor, although he's not a trainee, can I send them to your trust? So it's stuff like that. So
Okay.
it's bit of a hard work, it's bit of a paperwork as well, but I think everyone, it's your right that everyone who is working in NHS, they so because the problem is that staff grades or middle grades, they are usually appointed in trusts for service provisions, okay, and it is expected that because they are not in training grade, so they do not some people expect that they do not need that much of paperwork. But I tell everyone who is coming to UK, who is joining, that treat yourself like a trainee, do whatever trainees are doing, you just enter into that thing. There are, for example, in my trust there is East Midland teaching programs or that program. Either attend those teaching, make sure you use your SPA time. SPA time is the time that trust gives you, is a professional development time. It's your own time. Try to attend a teaching during that time, or if you cannot attend a teaching, make sure that you use your off days. There are certain courses that are happening, leadership courses, teaching courses, training courses, whatever you can do, try to get it done. And speak to your, so what I am trying to emphasize over here is that if you are coming to UK, or if you are joining, or if you are planning to join, first thing is do your homework, bring whatever stuff you can bring from your back home, number one. Number two thing is ask your department who is our educational supervisor, get registered to lifelong learning platform immediately. That is the second most important thing. Third thing is that whatever you are doing, even if it's a small simple appendicectomy case, RSI, anything, try to make sure that you upload it on lifelong learning. I also emphasize that never ever ignore your non-clinical domains. Like, try to make sure that you attend teaching sessions or audit programs or clinical audits or clinical governance thing. If you have got any communication with any consultants or other colleagues, make sure that patient name is anonymous, but you can also use that as an evidence, because they are asking you, have you had a communication with other person? So stuff like that. uh, Audits are very important, not only audits but completing a cycle. So in uh, so what I'll do in whenever we are doing our next presentation, I can go through that how you can do other stuff. But most important thing is that you have to start all these things as soon as you start working in UK. Number one thing. Another thing that I say, that even if you have not started it and you think that this is your 0 point. This is your starting point. Today is your starting point. So what I would say is that you can start using all your evidence. So I used most of my evidence uh, from the point I was working, because I was very lucky that I was working in a teaching hospital, and all of my consultants and colleagues, they were very supportive. They they actually supported me in like what teaching I would like to do. They actually treated me like ST7. So if there was anything that is happening in our trust, which ST7s would do, like organizing a journal club, or organizing a teaching, or organizing a something, so they helped me do that. I was very lucky that I was very well supported. Try to make sure that whatever you are doing is actually present in a, either in a scanned form or in a writing form, so that you can upload in your lifelong learning. I'm not sure how many people in this group are currently working in UK or who are planning to come to UK, but I'm more than happy to answer your questions. I think we can call it a day today, finish this meeting. And what I will do is that when we are doing next meeting, I can show you that uh, uh, what lifelong learning is look like and how they can start putting. So it will also give them an idea, even if they are planning to come to UK, that what Royal College expect us. So basically, when you are filling your application, GMC is the first stage, and then GMC send it to Royal College of Anesthesia, which assess your application. And then they give you like a recommendation that yes, this person can work as a uh, consultant here in UK, or this person cannot, or we want this and this much of evidence further, like this. Okay.
Okay. Okay.
I think it's not, it's bit complicated if you are hearing it first time, but once you start doing it and once you are in a system, so you will realize that in UK or anywhere in developed country, uh, evidence is very important. Whatever you are
Evidence is
working, evidence is very important.
actually, I will just try to make in slightly rephrase what you said. Unfortunately, back in our home countries, if we don't have the resources, or this is one thing is resources and one thing is intention. Unfortunately, sometimes we don't have resources, sometimes we don't have intention, the urge to do like that. So actually, this is very simple. That whatever, like for example, whosoever is coming to you to work with you under you, or as your colleague, you have more information, you need to share to them. And of course, if you are at a higher level, you have to monitor them, you have to give them feedback, you have to cover their mistakes, you have to tell them how you can improve. Am I right, is it the whatever you told is the summary is just like that? Even if you are not, this is something new for me, that even if you are not in a training program, even then you have a constant feedback system which will improve overall performance of the trust. Am I right?
Yes, and any person, for example, if I'm working in theater today, right, and my attitude today was not good, I was shouting too much, I was like cutting corners, or I started list late, or I started list I was rushing, I wanted to do cases back and back. uh, so this type of attitude, I've seen that sometimes it is acceptable in other parts of our, but over here in UK, anyone can complain against you. Either it's your theater ODP, either it's a porter who was not happy the way you shouted at them. So all of your
So
things. So
I think
basically
mentality
what
is
I,
the sorry, Hina,
yeah,
the I will just on a lighter note, the mind the gap. So mind the gap mentality is there everywhere. Am I right? Because
yeah,
first
so
time
I
when
think
first of all, first time when we reach UK, the most interesting thing we find it everywhere in the trains and all the transport. There is the word all the time they are saying mind the gap between the train and the platform. So I think the same mentality is there, that you have to respect your colleagues. Am I right?
yes. And so this is a thing. So I can guide you all from an aesthetic point of view, people who are joining UK. uh, And to be honest, there are colleagues, there are people whom I do not know from Pakistan who have joined in UK. I've tried to help them as much as I can. Whoever approach me, whoever ask me for any help, I try to make sure that if I can help, I try to help them whatever way I can. Uh, but in terms of your supervisors, in terms of your evidence uploading, in terms of lifelong learning thing, there are so many things that you have to take an initiative. There is no spoon feeding. No one will come and ask you, do you want to do Caesar, and I'm there to help you. No one will come and ask you. There isn't anything like that someone is after you having a stick in their hand. So you have to take an initiative, you have to be your own captain. Okay. So Caesar pathway, so this was my plus point when I was applying as a consultant post as well, that I always tell them that when you are working as a Caesar doctor, you are self-directed, you are more hardworking, because on one time you are doing service provision, but you are also keeping track of whatever uh, you are doing, just like trainees do. Although there is nothing as such, we are compelled to do that, but you are doing it. So they take it as a plus point. So the place where I worked as a specialty doctor, they offered me the job of a consultant as well there and then. When they knew me, and they know that this person has shown perseverance, this person is resilient, all these type of qualities which they want to see in a consultant. So Caesar is a pathway which is long. Everyone say it's hard, but for me, I would say it was, for me it wasn't that hard, or it wasn't that long. I think I enjoyed all this process, and I think people around me, they were very supportive. So I think I was lucky. But I think initial motivation should come from inside you.
Thanks a lot, Hina. You can sign off. I will just,
Okay, thank
I'm
you.
really thankful to you. Um, and any one of you have any question to me or Hina before she leave, or uh, you can, Hina, if you want to go, you are free.
Okay, thank you.
So, actually, anyone wants to have any question? There are some people from other specialty. I apologize to them, but I actually, what I will tell, that maybe you will find such paper like this one. This is for for anesthesia. Okay, you will find similarly specialty paper for like for all the specialties. So basic system will be the same, as she mentioned, that you have to document everything. There will be some educational and clinical supervisor who will be guiding you, like it's their responsibility actually, and not exactly, but somehow. Is Caesar accepted in Saudi for consultant position post? Unfortunately not. Okay, unfortunately not. You should have some experience, because I'm not sure about how, what is the paper, what you get after uh, you get remember one thing. Once till the time you are not in that system, you cannot guess everything. Okay, yeah, the question is, someone asked that why of Caesar, why not CCST? Actually, not everyone will be able to get this. Okay, these days what I have heard, that the easier pathway for CCST, easier pathway for the GP system is easier. People who go there, they enter in GP system and they become, like, their CCST is, I think, 3 years or something like that. For anesthesia, it's around 7 years. And she was using a word ST7. So ST7 means specialty trainee 7 year, seventh year. So they will assess you, like, as I told you, in our countries, like where we have exit system, actually, or there is a very clear cut demarcated system without too much evaluation of your overall personality. Like, you fought FCPS part 1, and whatsoever you are, you will be entering in the system. Okay, and if you don't pass FCPS part 1, you will not be able to enter in the system. There is no clear demarcation like that in UK. Okay, you will have to prove yourself that you are really good, only then they will let you get this. Okay, CESR is no more. They now give CCST or certificate to no, it's not like that. I'm not sure about it. If you, yes, Samsung, can you speak out, please? If you can just enlighten us. Zaid, answer to you is that nobody can help you unless you help yourself. Okay, of course, if you get a job and then you represent yourself in a nice way, there is no problem that you will not be entering. But I'm tell you, nobody can guarantee you a position in CESR unless you prove yourself. Can I listen from this person who write this message? Samsung SMA336E. CESR is no more. They give CCS2 certificate to all. Can you just tell how it goes, please?
जी, असल में ये हुआ है कि इसका
Just
जो रूलिंग है वो
can,
चेंज हो गई है।
just okay. Can you
Can you
speak in
hear
English,
me?
please? Yes, I can
Okay,
hear you.
so now the ruling has been changed, and
Okay,
now when GMC would whenever it considers you to be a specialist, so it will give you CCT even if your pathway is CESR.
very
So
good.
it's
This
no
is
more a separate CESR or CT thing now.
okay. So this is something new. That's why we need some, because whatever I tell people, I don't have first-hand information because I'm not working there. So you are already working in UK?
Yes,
Okay. So thanks a lot. What's your name?
Dr. Ahmed here.
Okay. So thanks a lot. So any other question? Any other questions, please? Okay, so I will just try to summarize that first of all, whosoever wants to go to UK, you need medical council registration. So it will be GMC. For that, either you have to pass the PLAB or you have to find some exemption. Okay, so this will be one way. There will be some certain qualifications which can give you exemption. Then you have to have the English exam that will be either IELTS or OET. And when you do both these things, then you will be registered in GMC. So initially, you will be getting a registrar job or SHO job according to your experience. And later on, as we mentioned, that you have to earn a position in their training system, either as a trainee or with the former equivalents. And this is something new told by Ahmed that now they have. And actually, if it is done like that, it's a good news. It's a good news because, but these things you can only be clear once you do go there. Before going there, unfortunately, you will not be able to get. Is this Dr. Hisham from Qatar? Is this Dr. Hisham from Qatar?
Uh, I'm sorry, no, I'm from Bangladesh.
Oh, okay. Sorry. Anyways, thanks a lot, all of you, for joining. And because today I was not planning, but because yesterday, unfortunately, I couldn't contact Hina. So today she was available, so I requested her to speak some of the points. Yesterday, actually my plan was to add on these things which we did. The recording will be available. Okay. How about MMD? What is this MMED certification? What is this? Can you tell? Okay, this question I will take first. So how many years for CESR after FCPS? Actually, uh, there is a certain criteria. You need certain, because their training is 7 years. Okay, their training is 7 years. Medical education certification. Okay, I have no idea. Actually, medical education is a growing thing, and whatever field you are in, if you have anything extra with reference to research with reference to certification for medical education, it will definitely help. Okay. So the question, the answer to this question for CESR, actually the training for them is 7 years. Okay. So once you reach there, according to the experiences or according to the paperwork you have, as she was saying that when you reach there, you should have all the papers or everything which you have done before with you. Okay. And then they will equate you usually, I think it is around 2 to 3 years at least for CESR, at least, not earlier than that. But actually, with the people who go there, at least they have to stay for 6 to 7 years for their passport. So because anyone who goes there, they have one of them, one of the aim, it will be to get the passport. Okay, so this is one thing. Another thing, Hina is exceptional. Hina is exceptional. She did everything in first attempt, FCPS, immediately went to UK immediately. So she is extraordinary. She has also done a fellowship in regional anesthesia. So not everyone will have that chance, of course, but everyone can have this chance. So you can, I know a lot of people who are there for 10 years, they are not able to get CESR. And I think she has spent 4 or 5 years in the same time which I spent in Saudi Arabia. I'm in touch with her for some years. So like, the motivation for all of you is that where there is a will, there is a way. If you want to do something, you will have to come out of your comfort zone. Only then you can do anything. Okay. So this is a message for you, and thanks a lot, all of you. Any question, anything you want to ask, you are all free to ask at this moment, or all of you are welcome to contact me later on. Okay. So a special thanks to Jennifer Rose, who is always there with us. And Jennifer, I just forgot, from which country do you belong? I again forgot actually. Jennifer, can you hear? I think she's not there. Anyways, thanks a lot, all of you. And inshallah, we will meet again. Thank you very much. After completing MRCP UK, can we get GMC registration? Yes, Dr. Kurat, we can get it, but I will never suggest anyone to go for MRCP. PLAB is an easier exam. Okay. If you want to listen one thing, this is what I am, because I will be telling you philosophical that thing is that it is just like in front of you there is a train going on, the door is about to close, so you put your stick, the door did not close, and now you enter inside, and there is no seat at the moment. You just hold a rod and you stand there. After maybe few stops, someone from the seat went out of the train, and then you get the spot. So this is similar to what your life will be once you are in UK or any other place where you have to compete for the training. You, like, for anything in other Western countries, remember, they are not there to provide you free cup of tea. You have to earn your place. This is one thing. So there will be nothing much you will get by spending your so much time in passing MRCP. Okay. So, and rather it is difficult to do MRCP from outside. Once you are in UK, you can do any exam. Okay. So first of all, you should be focusing to get the GMC. For getting GMC, the easiest route for any other person other than for anesthesia, it is something else. For other people, especially with a medical background, the easiest exam is PLAB. So PLAB is medical, like student level exam. It's a final year level exam. So don't be afraid from PLAB. So any people who are in planning to go to UK, I again tell, even the people who are in Pakistan doing MCPS or doing DA or any other specialty, any other thing like that, I will never suggest anyone to do specialty exam. It is better to do PLAB. This is one thing. Or still they want, because sometimes you are studying a specialty and you have very good preparation, then you can go for these specialty. But MRCP is a very difficult exam. So of course MRCP, is one of the degree which will give you exemption from PLAB. Okay, for anesthesia, primary FRCA is one of them. FCAI is one of them. European Diploma in Anesthesia is one of them. European Diploma in Intensive Care is one of them. Okay, so you can find. I will share some of the documents. I think it was here. Anyways, I will share to you that what exemption you can find online. Okay, so thank you very much, all of you. Inshallah, we will meet again. Bye bye.